Hi everyone, my name is Whitney and I'm a registered dental hygienist here to talk about dental implants, what they are, how they work, and what to expect throughout the process. Whether you're considering dental implants or just curious, I'll break it down step by step. Let's talk. Let's begin with the basics. What exactly is a dental implant? A dental implant is a permanent solution to replace a missing tooth. It consists of three main parts. One, the implant itself, which is the small titanium screw placed into your jawbone. It acts as the root of your new tooth. Titanium is biocompatible, meaning your bone will fuse with it over time, a process called osseointegration. Two, the abutment. Think of this as the connector piece. Once your implant heals, the abutment is attached to the implant and sticks out slightly above the gum line. And three, the crown. This is the custom-made tooth-colored cap that's attached to the abutment. It's what looks and functions like a natural tooth. Lots of people call this the implant by accident since it's the part you visually see, but for proper terminology, just know that this is the implant crown, not the implant itself, which is the screw. When the process is complete, the implant crown is so stable and lifelike that you usually can't tell it apart from your natural teeth. How to prepare for a dental implant procedure? Before your surgery, your dentist will perform several steps to make sure you're ready during your consultation appointment, such as discussing your medical history. They'll ask about any health conditions or medications that could affect the healing process after the surgery or during the surgery itself. They will talk about any potential benefits and risks and whether you are a candidate for the procedure in the first place, as well as a comprehensive exam. This includes x-rays or a CT scan to assess your jawbone and ensure there's enough surrounding alveolar bone to support the implant. Bone grafting if needed. If you don't have sufficient bone, a graft may be done to create a stable foundation. This could add a few months to your timeline, but it ensures long-term success. I do have a video all about bone grafts. If you'd like to learn more, I'll link it below. And lastly, they will create a treatment plan. Your dental team will review the timeline, costs, and any additional procedures needed, like extractions or gum treatments with you prior to your implant placement appointment. Pro tip, once it's time to make that appointment, to place the implant, to place the screw, the actual surgery appointment, be sure to wear comfortable clothes and eat beforehand unless otherwise instructed. Now, what happens during the procedure? The implant procedure itself is typically done in stages. First, placing the implant. That first appointment is the surgery. So after numbing the area with local anesthetic and or using sedation, maybe you prefer laughing gas or something even stronger, the dentist will make a small incision in your gums. Again, you'll be completely numb. You won't feel any pain, only a little bit of pressure. And then the titanium implant is placed into the jawbone. This part takes, give or take, 1 to 2 hours. It's really interesting to watch. Before I was a dental hygienist, I was a dental assistant and I assisted on surgeries such as implants, and I loved it. So if you're into that kind of stuff, ask if you can watch. Some offices have a TV screen where they can put your surgery up on the screen above you. If not, no worries. There's lots of online videos as well that you can look up. Or maybe you're someone who's listening to me right now and you're like, not at all. I don't want to see what's going on at all. All good. Bring headphones, listen to music or a podcast, and it'll be over before you know it. Because again, you'll be nice and numb and just hanging out laying there. And then once the implant is placed, the gum tissue is stitched back up. Next up is healing time, osseointegration. Over the next 3 to 6 months, your bone fuses with the implant. This creates a strong, stable base. Your dentist and or oral surgeon or periodontist, whoever is placing the implant, will let you know the estimated timeline for your individual situation. Then after it heals, for most patients, it's time to attach the abutment. Unless they did it at the same appointment they placed your implant, they'll let you know. But if you're coming back after healing, the dentist will reopen the gum to place the abutment. It's quick and usually done with local anesthetic only. This is a much faster appointment than the first one. Sometimes they will also scan that area today for your crown, or they may have already done that at a previous appointment. Again, it all depends on your individual timeline. And lastly, adding the crown. You'll most likely come back again for yet another appointment once your custom-made crown is fabricated and ready for you. Then they attach it to the abutment, completing the process. It will look like a natural tooth in your mouth. So yes, that was the overall process, but now let's talk recovery tips. And these are mostly for after that first surgery appointment, after your consultation appointment, when they place the implant, the screw into your jaw. Number one, you'll want to manage discomfort. Use any prescribed painkillers or over-the-counter medications that were recommended for you. Ice packs can also help reduce swelling. Number two, stick to a soft food diet. Foods like yogurt, mashed potatoes, and smoothies are your best friends for the first few days. Number three, keep it clean. Gently rinse with warm salt water or a prescription mouthwash if recommended by your dentist. Again, they will let you know your individual swishing recommendation. But regardless of what you're swishing with, be sure to swish your head back and forth like this versus swishing really hard with your cheeks like this. It's just more gentle to move your head instead. And most likely your dentist will also advise you to avoid brushing directly on the implant site until they give you the green light. Now, as you may have already gathered, all of these tips I have in this video are generalized tips just to give you an idea of what's to come. But always number 4, listen to your dentist regarding your individual situation. Attend all follow-up appointments to monitor healing and avoid smoking, which can interfere with healing. Lastly, once your implant is complete, you have the abutment, crown, all the parts, and your dentist has given you the green light to start brushing in that area again once they say it's okay. Once you're healed, it's so important to understand that maintenance is extremely important for the longevity of your implant. The good news is it's nothing too fancy. Home care is very similar to caring for your natural teeth, including brushing twice daily using a soft bristled toothbrush. Again, don't brush that area until they tell you it's okay. These tips I'm about to go over now are for once you get the green light to go back to your normal routine. Flossing regularly, paying special attention to the areas around the implant to avoid plaque buildup. Some dentists will recommend you also use proxy brushes in those areas, whereas others might recommend water flossers and or super floss. There's a bunch of different ways to floss around your implants, so always ask your dentist who placed the implant what is the best way to clean it for your individual situation. I do have a caring for your implants at home video with more generalized advice, which of course I'll link below. Additionally, keep up with your routine checkups. See your dentist and dental hygienist regularly for professional cleanings and exams. With proper care, your dental implant can last a lifetime. They're the best tooth replacement option available, so be sure you are caring for it daily to keep the gums around it healthy. Overall, dental implants are the best. However, they can be an investment, so understanding the costs up front is important. A breakdown of what you might pay for includes a CT scan and x-rays. These imaging tests are usually an additional cost. Implant placement, the titanium implant itself. Abutment, the piece connecting the implant to the crown, the visible custom-made tooth. Sometimes these fees are bundled, but other times they're billed separately. So if finances are of concern, be sure to ask these 2 questions. 1, are all costs included in the estimate, including x-rays and the crown, etc.? And 2, does insurance cover any part of the procedure? It's good to know if your insurance will cover 50% or 80% or 0%. Very good to know these details ahead of time so you can avoid any surprises later. And if you don't have dental insurance, always ask if financing options are available through your dental office or a third-party payment program. Although be careful with those third-party payment options. Sometimes after 12 months of financing, the interest skyrockets. So those are good if you know you can pay them off in time. But if you're not sure, something else I always recommend to look into is something called dental discount plans. I will link my video all about them in the description box below if you'd like to learn more. These plans can be a great alternative to traditional dental insurance for many people, getting you the care you need when you need it. All the information is in the description box below. In all, I hope this video helped you. If you have any tips or tricks regarding your experience with dental implants, be sure to share your stories in the comments below. And don't forget to like, subscribe, and turn on your notifications if this video helped you. And until next time, I'll see you on Instagram at Teeth Talk Girl. Peace, love, and teeth.